Thank you so much, Marco. We started Babylon with a simple question. How do you make healthcare the same way? How do you do with healthcare what Google did with information? How do you make it accessible, affordable, and put it in the hands of every human being on Earth? And to do that, accessible is almost easier. As long as you can deliver most of the healthcare most people need on the devices most of them already have, that's highly accessible. The question really becomes, in healthcare, one of affordability. How do you make it so cheap that most people in the world can afford it? And when to do that, you need to look at the two areas where most of the costs in healthcare sit. One is in people. 2/3 of all the money we spend in healthcare in Britain, for instance, goes into salaries. And two is in prediction, timing. Most diseases, by the time they demonstrate their symptoms, a $10 problem has become a $1,000 solution. So what we do in Babylon is to create technology that can deal with those two issues. Without spending much time talking about it, it's perhaps best if I show it to you. What I'm going to show you, most of this is already in the market, but I'm going to also show you bits and pieces of this that is not here yet. If I can have my phone connected to the screen, that's great. So for those of you who don't believe in miracles, that woman married me. OK, so Babylon is an artificial intelligence agent that sits in your pocket, that monitors you for everything that you do to help you with your health. And here it goes. Let me show it to you.
Hi, Ali. Looking at your calendar and emails, I see you've been really busy recently. How can I help today?
Hey, my tummy's killing me.
Unwell. Try not to worry. Stomach pains are really common and they're normally easy to treat. Are you happy to answer a few more questions?
So she understands that killing me doesn't mean call the police. It means that it just hurts. But what we are going to do now is use our fingers, because what we've discovered in trials is people actually talk too much. So to get them to answer a question precisely doesn't usually work. So let's just say yes.
First things first, where is the pain in your stomach?
Let's just say it's up here.
How bad is it?
Mild.
Got it. Which word best describes the pain?
I know, you could say anything. Let's just say burning.
I see. Does it come and go?
Yeah.
Okay, don't worry, we'll get it sorted out. How long have you had the pain?
Let's just say a week.
Sometimes pain like this can be worse lying down. Are you finding that?
No.
Right. And is the pain getting better or worse?
It's the same.
This is important. Do you feel sick?
No.
Okay, we're nearly there. Do you have a fever or feel unwell?
No, I'm okay.
Right, just a few more questions. Have you noticed any difficulty swallowing?
Everything you see up to here, by the way, is already in the market. The British government, the National Health Service in Britain, has deployed it in what is the largest deployment of artificial intelligence in medicine to 1.5 million people in UK. And what we've seen is almost 40% of those people deal with the artificial intelligence and do not come any further. What you're going to see now, it's new. That we will deploy in a couple of months' time, because what we've done is gone from clinical triage now to what is diagnostics. We will do now what a doctor does, which is diagnose and tell you exactly what's the disease.
Okay, I'd just like to go over some information from your profile. Have you managed to cut down on fatty foods using the diet plan I gave you?
So she's going into my clinical data. She's finding out that I love fatty food, and she's saying, am I cutting it? Let's just say a little.
Okay, and are you still taking regular ibuprofen for your back pain?
I'm okay now.
Right, Ali, I now have all the information I need. Give me a few seconds and I will see what's going on.
Sure.
The good news is your symptoms don't seem worrying on a medical level. This sounds like dyspepsia to me. Dyspepsia is doctor speak for indigestion. It is an increase in stomach acid, which can cause burning abdominal pain. This is a really common condition, particularly amongst men of a certain age.
Okay, enough. So, and then what you see is that she has a summary of our conversation. She can tell me everything about the specialists I need to know. And of course, if I do need to talk to a doctor, I can make an appointment and talk to one. But what that doctor will have is the diagnosis. So what we find now
Okay, here's the next available GP appointment.
What we find is, just go ahead and book it.
That is great.
And then what we find is that 50% of our patients, since we launched our clinical triage, are not coming to us. Of those who are coming, we can treat them in 50% of the time in trials now because our doctors are getting the answer. So when the consultation happens, we just have a face-to-face. When it's finished, we rate it. People who use this love it. I mean, if you go to our website, you see live all the rating. We have now something like 18,000 five-star rating. I don't know if there is a five-star hotel in this city that has that many. But much more importantly, the machine, we had to develop what is the world's most accurate natural language processing understanding in medicine. So the machine is listening to the consultation, and then it can tell me what is, write the notes for the doctors to save them the 15% of the time they usually spend on that. And then if I want my medicine, I either collect it from a pharmacy near here, or it'll come to a, or I can send it home. I can see our Wi-Fi is not as strong as I thought, so let's just send it, deliver it to my home, and we're done. Now what happens? In 40% of the medicine we prescribe in the world goes wasted. People don't use them. So because they forget, they're not encouraged, but we can encourage them. We can come and say,
Ali, it's time to take your medicine. Have you taken it?
And if I say no, she'll try to encourage me. Not really.
Ali, are you being a bit naughty? Don't you think you should take your next tablet?
Sure, I'll take it. But then, what happens is that 1 in 8 diagnoses in Britain is misdiagnosed. In Germany, the number is the same. In America, it's 1 in 7. In Nigeria, it's 1 in 3. How do we know that what we diagnose is correct? So we can come at the end and ask you that.
I can see you have finished your course of tablets. Are you feeling better?
And let's just say sure, and then we're done.
Good job. Keep it up.
Now, everything I showed you, that's not healthcare. That's sick care. I got sick. The machine, in a much better way, looked after me, connected me to a doctor, fixed my problem. And we can do so, as I described, at 80% less cost than the normal system. That's why in Britain today, we can deliver 24/7 healthcare, 365 days a week at £5 a month. At £5 a month, when we do it publicly. Now, the question is, how can we do this for you? All the conversation I do with you, here is what I get. I get a full avatar of me. This is a rather flattering avatar of me, but what we've done through all this conversation, replicated me organ by organ, item by item, across everything, from my heart to my kidney to the health of my vitamin shape, everything, across my biometrics, my behavior. You see it around my environment and my genetics. And what that allows me to do is to then predict my health, which is to see when something is going wrong ahead of it going wrong. So for instance, if I now look at my chances of developing type 2 diabetes, I can see very quickly that it knows everything about me apart from the fact that my parents have it or not. Let's say no, and within seconds, it can calculate that I don't have type 2 diabetes. Let me finish, as my time is coming to an end, with telling you what really that does. It allows us to deal with problems in healthcare actually well before they start. So today in Germany, 20 wonderful human beings will commit suicide. For every one of them, another 10 will attempt it and fail. 10,000 people in this country today are sitting at home with clinical depression and not leaving their house. But what if we could intervene? What if we could monitor them and come with their permission and warn them?
I have noticed that you are using your phone a bit more than usual and have not left the house for the last 3 days. I just want to make sure that everything is okay. Would you like me to book you an appointment?
Everything's good. I've been watching too much TV. But so you get a sense of what we can do. We can make today, with healthcare soon, what Google has done with information. We can make it affordable, accessible, put it in the hands of every human being on Earth. We're doing it in UK, but we are also doing it in Rwanda, one of the poorest countries in the world, where in 6 months, 10% of the population signed up and became members of Babylon. We can deliver it at prices less than $1 a person. Thank you so much for listening.